One of the great things about plastic surgery is the variety and the breadth of things that you can do to help a patient look how they want to look and feel how they want to feel. My name is Mike Tecce. I'm a plastic and reconstructive surgeon at Mainline Health. My main focus is plastic and reconstructive surgery. One of the beautiful things about being a plastic surgeon is we operate from the scalp all the way down to the tip of the toe. So we work with a lot of different specialties, which enables us to be very dynamic in terms of the operations we can offer. A lot of the work that we do centers more around the torso, so we wind up doing a lot of breast procedures, whether that be cosmetic or reconstructive, a lot of procedures on the abdomen. We work very closely with breast surgeons. We really want to have a unified approach to treating a patient, to be able to have all of the other surgeons on the same page with their treatment plan, to make sure that they're getting the right level of treatment. Fortunately, we're able to offer not only implant-based surgery, but also using your own tissue, which is a type of procedure where we're able to transplant one part of the body to another part of the body in order to reconstruct the part that was taken by cancer. There's nipple-sparing and there's skin-sparing mastectomies. Those are the two main types. And so the decision for that is really a shared thing between myself and the patient. It's about figuring out what's going to fit best for them in their lives. One of the tenets that I try to practice is that really I am there with the patient from their first surgery all the way through the reconstructive end. It's really a shared relationship in terms of me trying to learn more about them and their goals and what they want to see happen. Focusing on the after effects with breast cancer treatments. What happens several months after their treatments are done or a year after? Do they have lymphedema? Do they have soreness at their surgical sites? Are they adapting and getting back to their normal lives? So one of the important things I think that we are trying to focus on is really that aftercare dynamic, which I think is important for their overall recovery. I'm one of the few surgeons in the area that can perform reconstructive surgery and microsurgery for lymphedema. And what that means is that I'm taking the tiny lymphatic vessels that are full of fluid, and I'm able to reroute them into a vein to give somewhere for this fluid to go. I also perform cosmetic surgery as well, and I do that from head to toe. So focusing on areas of the face that might require or benefit from facial rejuvenation strategies to working on the breast and abdomen as well. Breast procedures would include things like a breast lift or a breast reduction to breast augmentations. One of the advantages of joining Mainline Health is the opportunity to bring a high level of reconstructive surgery found traditionally only at tertiary care centers into the community setting, to be able to keep patients closer to home and offer them advanced techniques that traditionally you could maybe only get at bigger centers. The best part of my day by far is having somebody who comes in and says, "Hey, thank you so much for helping me with whatever it was that we did to help them feel better and do better with what they're doing." That's the best part for me.